Well, a stroke happens when blood flow to a part of the brain stops. So kind of think of it as a brain attack. Symptoms vary, and in some cases, a person may not know that he or she has even had a stroke. Well, Dr. Howard Jonas is chairman of UNM's Department of Neurosurgery and joins us today with more information on this very important topic. Hello, doctor.
Good morning.
It's great to have you with us. I think this is a very important topic, and so I want to start by asking you to just explain the types of stroke.
Well, in your introduction, you said stroke is when blood gets blocked, but it's actually two things. There's a type of problem where an artery gets blocked. And there's another type where an artery ruptures. So you can have bleeding in the brain, or you can have a lack of blood supply to the brain.
And what's interesting is I also mentioned a lot of people don't even know when it's happening to them. So is an aneurysm a type of a stroke?
Well, an aneurysm is a type of stroke where there's bleeding, where something ruptures. And everybody knows when they have an aneurysm rupture,
Right,
it's the worst headache of your life. It hits as a sledgehammer. The real problem is that lots of people will have a spell, they'll have a weakness, they'll have a numbness, and then they'll sit around and wait and see if it goes away. And that's where our real problem is, because if it's a blocked artery, time is brain, as you just said, and so that the quicker we recognize it, the quicker we get treatment. If it is a lack of blood supply, there are treatments to open arteries as quickly as possible. And so that's really the game, is recognize the problem, seek care, don't go to sleep and wait to see that if it's gone in the morning, because if it's not, you've lost the window.
No, it's life-saving advice, it really is. And you know, we hear a lot of people talk about when they've had a stroke or they know someone who has, and they'll say, well, it was a mild stroke or it was a severe stroke. What's the difference between the two?
Well, the brain's just a giant computer. It has areas in the brain that are very vital, very small areas that control your hand. A very small area controls your speech. And another area is sort of quiet. We don't know exactly what it does. So if you happen to have a small stroke in a quiet area, you just might not feel quite right, but function all right. I mean, if that stroke involves a blockage of an artery to that critical hand and speech, it's very obvious. So it has to do with the location of the stroke. It has to do with the size of the stroke.
And then therefore that affects all of our movement, all of our speech, all of those different things. And so if we think about people out there who may be at risk, who would we be warning? Who is at risk for a stroke?
Well, unfortunately, New Mexico is one of the prime areas in the country with a high incidence of stroke. And it has to do with being overweight. It has to do with high blood pressure. It has to do with, you had a segment on smoking, where young people are smoking. Smoking correlates with increased cardiac disease, also correlates with brain disease, arteries blocking, and uniquely causes aneurysms in the brain. So a lot of reasons not to smoke.
No doubt about it. And when you think about those things, knowing those are symptoms, those are things that could cause a stroke, then we want to prevent that. And so if we are, God forbid, having that happen to us, what are some of the symptoms we should be looking for?
Well, really, it's any loss of function. It's strength, speech, cognition, you just
Headaches,
can't remember. If it's bleeding, it's usually a headache, terrible headache, associated with some weakness or numbness.
Good to know. And so you talked about some of the potential causes. Can strokes actually be prevented by avoiding those things you mentioned?
Definitely. Avoiding hypertension, treating diabetes, not smoking, decreases the incidence of stroke greatly. And for most of us, as we get a little bit older, a little bit of aspirin is a very good thing. A baby aspirin once a day, very good thing.
Good to know. And so now you talked earlier, and I said let's talk about this a little later, but you did mention there are treatments available. So how are they treated?
Well, if you block an artery, you get to the emergency room within a few hours, the treatment is try to open up the artery, and that's given with a medication that breaks up clots. If it's a rupture of an artery, like an aneurysm, then you enter some very, very complicated pathways where we have to see the aneurysm, understand exactly what it is. And today we can treat it with open surgery or with a catheter, like the heart doctors go into the heart. We have little tiny catheters that go into the brain, into the aneurysm, and like the little Dutch boy can plug up the aneurysm.
Gosh, isn't it
So we have
amazing?
lots of treatments. We just need the patients to come to us early.
We absolutely do. And so let's tell our viewers right now where they can go for more information.
Well, do we have a number up there?
We sure do.
Excellent.
We can go to either 505-272-0760, or you can also call 505-272-3700. 3160. Valuable and again, life-saving information you provided us with today. Thank you so much.
Thank you.
Thank you.